Coronavirus pandemic has affected my business vastly because mainly most companies that we supply goods, they have not been able to pay back.
My own side is not real because being looking at it in our area, I have not seen someone that they say, see this person that coronavirus have cashed. We did not see it. So in my own side, it's not real.
It's actually real, but the government are not making us believe it is.
I am using this opportunity to express our deepest condolences to the families of all Nigerians that have lost their loved ones as a result of the COVID-19 pandemic.
For the past 1 year, people of all races, languages, whether in developed nations or developing countries, have for once in centuries been combating a common enemy. The COVID-19 pandemic, which broke out from Wuhan, a city in China, has since its outbreak spread like wildfire, journeying from the Asian country to every continent. The most populous nation of the African continent, Nigeria, joined other countries of the world in battling the novel coronavirus on the 27th of February 2020. The first index case was of an Italian man who returned to Lagos from Milan on the 25th of February 2020 to resume his work in the nation's commercial center. By that time, Italy had already been hit by the viral pandemic. The ravaging virus has since then introduced anomalies in every sector, while more people have become more health conscious. Here is how Nigeria has responded to the virus thus far. A few days after announcing the index case in Nigeria, prices of some health products like hand sanitizers and face masks shot up uncontrollably due to the panic of contracting the virus among people and the need to protect oneself from the virus. The government, swinging into action, set up the Presidential Task Force on COVID-19, collaborating with the Federal Ministry of Health through the National Emergency Operations Center, led by the National Center for Disease Control, to provide a national response to the novel disease. The COVID-19 task force, needing cooperation from the citizens, introduced several preventive measures that became inevitable just as early advised by the World Health Organization, some of which are cleaning of hands for at least 20 seconds with soap and water or with an alcohol-based hand rub, maintaining a safe distance from anyone who is coughing or sneezing, wearing a mask when physical distancing is not possible, avoid touching your eye, nose, and mouth, covering the nose and mouth with a bent elbow or tissue when coughing or sneezing, staying at home if feeling unwell. Also, international flights were banned, effective from the 23rd of March 2020, while exempting emergencies and essential flights and all land borders closed. Despite these measures given, Nigerians saw the numbers of new COVID-19 cases rise by the day, consequentially leading to an unavoidable lockdown. President Buhari, in his nationwide broadcast on Sunday, March 29, 2020, after reflecting on the pandemic attack of coronavirus and its huge toll on nations across the world, directed cessation of all movements in Lagos and the Federal Capital Territory for an initial period of 14 days with effect from 11 p.m. Monday, March 30, 2020. Ogun State was added because of its proximity to Lagos and had traffic between the two states. As at this time, Governor El-Rufai had already tested positive for the coronavirus.
This week, I submitted a sample for the COVID-19 test. The result came in this evening, and I regret to say that it is positive.
The lockdown was later extended by another 2 weeks, with more states joining these states as measures to reduce the spread of the virus. During the lockdown, more prominent people became a victim of the virus, some of which are Governor Seyi Makinde of Oyo State, tested positive for the virus on the 30th of March and recovered weeks later. President Muhammadu Buhari loses his Chief of Staff, Malam Abba Kyari, to COVID-19 on the 17th of April 2020. This compulsory shutdown of business activities left untold hardship on citizens, with many already groaning of hunger and not getting enough from the government.
Please tell our government, let them put more effort. Let them put more effort. This thing is getting too much for we people. We can't know what to do.
People cannot stay for that 14 days. We not fit. People cannot. Wallahi, people cannot. At all, people cannot fit. Wallahi, Gari 1,000. Gari 1,000. 450, 1,000. Rice 2,000 now. Ike 2,000. Why people can stay?
However, to reduce the fangs of this unavoidable shutdowns, well-meaning individuals joined their resources together, setting up the coalition against COVID-19, a private sector task force aimed at supporting the government in combating the virus. Though this step is commendable, implementing and supervising the project became a problem, as many lament corrupt practices of the officials in charge of distributing these palliatives.
This is what they are showing people, and it's unfair. It's unfair. So Lagos State should caution these people that are handed over this thing. Now they brought relief materials to this place that was supposed to shed to people, but these guys are hoarding these materials. They refuse to give it to people. You see them stocking their vehicles and taking these things away. Now we told them, let us do this thing orderly, but no. Now people are starting rebelling. They called police officers to come and quell these things, but nothing is being done. Up to now, they brought this thing since 12. This is almost to 6. They are yet to share this thing out. People are hungry. They are here. They're supposed to give it to them. But why are they holding it in the first place? Why have they refused it to give to people? Now, some have taken it home. Some have put it in their cars. They've refused to give it to people. They became selective in sharing it. This is so unfair.
The councillors and some council staffs, they came behind and they shared all the rice amongst themselves. They brought cars. Most of them took 20, 10, 15 bags.
After months of staying indoors, the federal government was under pressure to order the gradual easing of the earlier imposed lockdowns, as the national economy has been affected by the absence of commercial activities for months. This was announced by President Muhammadu Buhari in a broadcast that took effect on Monday, 4th of May, with the cases of COVID-19 in Nigeria already hitting 2,802 confirmed cases.
Based on the above, and in line with the recommendation of the Presidential Task Force on COVID-19, the various federal government committees that have reviewed socio-economic matters and the Nigerian Governors Forum, I have approved a phased and gradual easing of lockdown measures in FCT, Lagos, and Ogun State, effective from Monday, 4th of May 2020.
Now the policy has cost the country over $373.5 billion, according to a study on the impact of COVID-19 lockdown on the Nigerian economy. While the Nigerian cinemas alone recorded 8 billion naira revenue loss during the lockdown, and Nigerian airlines recording over 170 billion naira loss to the COVID-19. As business activities resume in the states, measures were put in place by the state government to keep the infection at minimal rates. These measures include curfews from 8 p.m. to 4 a.m., which was later adjusted to 10 p.m. to 6 a.m., the compulsory use of face masks in Lagos, and the reduction in limit to passengers a bus can carry per trip to 60% capacity.
A lot of people seem to have this thing in their heads that LASMA is just there for traffic. Why would they be enforcing face masks? It's because anything to do with enforcement, authorized officers are in the law is empowered to enforce. It doesn't have to be a moving vehicle, whatever. And because you're inside vehicles and on the road, is the link between LASMA enforcing such things or not.
Even with these measures in place, more infection rates were recorded daily, with more prominent people testing for the virus. On the 25th of June, the former governor of Oyo State, Abiola Jimobi, died of coronavirus, being the second elite lost to the virus. Others who tested positive for the virus include Dr. Ifeanyi Okowa, governor of Delta State, founder of Dark Communications, Raymond Dokpesi, governor of Ondo State, Rotimi Akeredolu, who in less than a week tested negative to the virus. However, Amidst the panic, Nigerians saw a light of hope overcoming the virus when the news of the Madagascar organic cure made it to the headline of every news channel. But Madagascar's coronavirus herbal concoction was later said not to be potent as claimed.
You cannot say that a medicine can cure or can treat a disease without clinical trial. In the general public, the word treatment is not the same the scientist looks at the word treatment. Treatment means I've already proved that with science, with clinical trial, that it can do ABC. That is to what scientists see as treatment. The general public may not know that you cannot say this thing can cure this or treat this without having evidence.
As of the end of 2020, the total confirmed COVID-19 cases in Nigeria was 87,510, 73,713 fully recovered from the virus, while 1,289 people are reported dead from the virus. Many #EndSARS protests or the other, all contributing to the rise or fall of the cases recorded daily. Meanwhile, in 2021, Nigeria is still worrying against the virus, even experiencing a second wave of the virus presently. The Presidential Task Force team on COVID-19 has blamed the spike in the new cases on the complacency of the citizens not adhering to the preventive measures in place to combat the disease anymore. Therefore, there are indications that the federal government will reluctantly announce a fresh lockdown in the country as Nigerians are not complying with the just signed executive order that makes mask wearing and observation of social distancing in the public mandatory. Now, closer than ever, the world is moving towards overcoming the virus as news of some approved vaccines such as Pfizer and AstraZeneca vaccines have surfaced. While other nations are already vaccinating their citizens, Nigeria is still yet to start vaccination of its citizens. These are the high and low, hope and darkness in Africa's most populated country since its first case of coronavirus on the 27th of February 2020. For more updates on coronavirus, latest news and news on the go, log on to independent.ng and do not forget to subscribe to our channel for more videos. This is TV Independent.